Hello and welcome to my YouTube channel. Today I'll be speaking on UTI, urinary tract infection, sometimes called waterworks infection. Imagine for a moment how the urinary tract is constructed, and if you have this basic anatomy, you'll be able to understand what I'm about to discuss. Blood gets to the kidneys, and from the kidneys, urine is made, and it passes through tube-like structures called ureters into a collecting area called the bladder, and then through a tract, urine is passed outside. So you have the kidneys on both sides, the ureters, and then the bladder, and then a tract called the urethra. Urinary tract infection can affect the kidneys. Where it affects the kidneys is called pyelonephritis. If it affects the bladder, it's called cystitis. If it affects the urethra, it's called urethritis. What are the symptoms that could occur in UTI or waterworks infections? I'll mention the medical terminology and then explain. Number one is dysuria. In dysuria, patients complain of pain or a burning sensation when passing urine. Number two, frequency. When there is a need to pass urine more frequently. For example, you know that in the day period, you typically would go to the bathroom or to the restroom, say 2 to 3 times. Now you're observing that you're going about 5 or 6 times. We call that frequency. When it occurs in the day, it's called frequency. When it occurs at night, in other words, waking up more frequently than usual, we call that nocturia. And then there could also be pyuria, where there is white blood cells or pus in the urine, where the urine now looks cloudy. And then number 5, hematuria, which means passage of blood in urine. The symptoms of urinary tract infection could include low abdominal pain, low back pain, fever, and delirium. Delirium means an acute confusional state that could occur particularly in the elderly patients. Who are those at risk? Number 1, pregnant women. Number 2, children with urinary tract abnormalities. Number 3, patients that have an enlarged prostate, constipation in children, conditions that block the urinary tract such as kidney stones. So in terms of patients at risk, just picture for a moment anything that causes stasis or reduced flow of urine will trigger or create an environment where organisms can grow or cause infection. Those that are on the catheter, a catheter is simply a tubing that is passed through the urethra to collect urine from the bladder and then bring outside the body. Patients that have diabetes or on chemotherapy. Why is this so? Because of the weakened immune system, and so they're predisposed to developing infections. Menopause, after coitus, inadequate hydration are all situations that can position people to be at risk of developing urinary tract infections. The organisms could be viruses, could be bacteria, could be fungi, and so any of these could actually present or cause urinary tract infections. What essentially happens? How does this occur? For a moment, just picture somebody going to use the bathroom or the toilet. If the bacteria in the poo goes or enters the urinary tract, it could track along the urethra, that's the initial pathway, causing urethritis, moving up onto the bladder, causing cystitis, and if it gets to the kidneys, it can cause pyelonephritis. So it's important to mention that women have a shorter urethra than men. The implication of this is that the organism has a shorter amount of time to get to the bladder and to the kidneys. So women will be in a position to possibly develop urinary tract infection more often than men because of the shorter urethra. How is the diagnosis made? Typically, clinically, I've mentioned features such as frequency, nocturia, dysuria. These are terminologies I've already explained at the beginning, at the earlier part of the video. And then we could also do urine test. This could be a urine dip or culture to determine the specific organism causing this, and then sometimes sensitivity to determine the particular antibiotic you need to use to treat the condition. And so in terms of treatment, could be use of analgesics for pain reduction and then antibiotics. Antibiotics will be guided depending on what is prevalent in the environment or what the urine culture and sensitivity brings up as a result. So how do you prevent urinary tract infection or waterworks infection? When you use the bathroom, when you wipe, you need to wipe from front to back. Number two, you need to keep the genital area clean and dry, and so it's important for you to have good personal hygiene. You've got to drink adequate amounts of water, and if there is an urge to pass urine, do not hold urine beyond what is necessary. As much as you can, use the bathroom and don't wait until you're pressed and then keep holding. Remember, if the urine stays, the longer it stays, the greater the tendency for an infection to occur. And then, for those that are you've children on nappies or those that have that need to use incontinent pads, as soon as they're soiled, change them. There's also possibility of use of cranberry juice, which contains the substance that prevents the bacteria from sticking to the wall of the bladder. So cranberry juice can also be used to prevent urinary tract infection. So urinary tract infection, waterworks infection can be caused by different types of organisms, but there are steps that we can take to ensuring that we do not develop urinary tract infection. If you've learned something, like, subscribe, and share.